Attention Deficit Hyperactivity Disorder and Narcissistic Personality Disorder are two distinct psychological conditions that have been extensively studied over the years. However, recent research suggests there may be an intriguing intersection between these two disorders. Before we can explore their intersection, it's crucial to understand each disorder separately. ADHD is a neurodevelopmental condition that manifests as chronic patterns of hyperactivity, impulsivity, and inattention that are more severe than typically observed in individuals at a comparable level of development. Inattention in individuals with ADHD may present as forgetfulness, an inability to sustain focus during tasks, or difficulty in following instructions. This characteristic often leads to significant challenges in academic settings, where consistent attention to detail is required. The hyperactivity aspect of ADHD often manifests as excessive fidgeting, restlessness, and an inability to remain seated for extended periods. This can be disruptive in structured environments like classrooms or workplaces. Impulsivity, the third major symptom of ADHD, may involve hasty actions taken without thought of the consequences, an inability to delay gratification, or frequent interruptions during conversations. These impulsive behaviors can lead to difficulties in social situations and personal relationships. Narcissistic personality disorder is a complex mental health disorder that manifests as a pervasive pattern of grandiosity in fantasy or behavior, an unquenchable need for admiration, and a notable lack of empathy. The grandiosity associated with narcissism isn't merely about having confidence or high self-esteem. Instead, individuals with NPD have an inflated sense of their importance, believing that they are superior, unique, and should only associate with people or institutions that match their perceived high status. Another striking aspect of narcissism is the profound lack of empathy for others. They will manipulate or exploit others to meet their own needs, look down on the people around them, and harbor ill feelings towards those they perceive as rivals or threats. ADHD and NPD are two different mental health conditions, but they share some overlapping symptoms which can sometimes complicate diagnosis and treatment. Understanding these similarities is crucial for a more nuanced view of these disorders and their interplay. One of the key overlapping symptoms is difficulty in maintaining attention. For individuals with ADHD, this stems from an inherent struggle with focus and distractibility. They find it challenging to concentrate on tasks, particularly those that they do not find interesting. This can lead to frequent shifts in attention, unfinished tasks, and seeming forgetfulness. On the other hand, individuals with NPD also struggle to maintain attention, but for different reasons. Their difficulty often arises from a lack of interest in others, particularly if the conversation or situation does not revolve around them or serve their interests. This may manifest as apparent disinterest, frequent topic changes to refocus attention on themselves, or dismissive behavior towards others' thoughts and feelings. Impulsivity is another trait commonly found in both ADHD and narcissism, albeit with different presentations. In ADHD, impulsivity often manifests as hasty actions without forethought, difficulty waiting for their turn, and a tendency to interrupt others. These behaviors are typically driven by an inherent difficulty in inhibiting responses, leading to actions that may seem thoughtless or reckless. In contrast, the impulsivity seen in NPD is often linked to their need for immediate gratification and their disregard for others. They make rash decisions to fulfill their desires or assert their perceived superiority, often without considering the potential impact on others. This can lead to impulsive behaviors that disregard social norms or the boundaries of other people. While these overlapping symptoms can present challenges in distinguishing between ADHD and NPD, understanding their nuanced differences is crucial. It allows for a more accurate diagnosis and effective treatment plan, tailored to the unique needs and experiences of each individual. Research has increasingly delved into the intersection between attention deficit hyperactivity disorder and narcissism, revealing intriguing correlations and potential overlaps between the two. A study published in the Journal of Clinical Psychiatry found a notable correlation between ADHD and narcissism. According to their findings, adults with a history of ADHD exhibited greater rates of antisocial, histrionic, and narcissistic personality disorders compared to the general population. This suggests that while ADHD and NPD are distinct disorders, there could be an increased predisposition towards narcissistic traits in individuals with ADHD. However, it's critical to note that this does not mean all individuals with ADHD will develop narcissistic traits or NPD. Rather, it indicates a potential vulnerability that merits further research. Interestingly, another study published in the Journal of Affective Disorders proposed that individuals with ADHD might display narcissistic behaviors as a coping mechanism for the challenges and struggles associated with their condition. These behaviors may serve as a way for individuals with ADHD to navigate their symptoms, albeit in a manner that can potentially strain their interpersonal relationships. Further research points to a high genetic overlap and natural co-occurrence between some personality disorders and adult ADHD, including narcissistic personality disorder. This adds another layer of complexity to the relationship between these conditions, suggesting the possibility of shared genetic factors contributing to their development. It's also worth noting that comorbidity, or the presence of two or more disorders in the same individual, is not uncommon in mental health. In fact, another study published in the Canadian Journal of Psychiatry examining comorbidity in adults with ADHD found associations between ADHD and several disorders, including narcissistic personality disorder. So, while ADHD and NPD are distinct disorders with their own unique symptom profiles, research suggests potential overlaps and correlations that shed light on the complex interplay of these conditions. In conclusion, while the intersection between ADHD and narcissism is complex and multifaceted, emerging research provides valuable insights into this connection. Continued research in this area is crucial to further unravel these connections, paving the way for improved diagnostic accuracy, more effective treatment strategies, and a more empathetic societal response. For more information about mental health, visit www.carlacorelli.com.